welcome to my channel. I'm Camila. Still no news about if I'm pregnant or not, but let's keep our hopes up. And today this video is special for some subscribers who wrote comments about how sad was the exam I did at my fallopian tubes. I want to answer them and explain to everybody why I didn't have an anesthesia and why it was so painful for me. And today also, look who's here, Pudim. You want to stay with us? So here's some comments I received, and what I can tell you, my family said the same. My father and my siblings, they work in the hospital. They got shocked when they discovered I had this procedure without anesthesia. Can kind of understand what happened. So let me try to explain to you what happened. First, let me explain how is the procedure, okay? So they laid down me on the hospital bed. They tied my legs, not my hands were free. And I had to open my legs. And I had some machine come into the direction of my womb. That machine pressed me on the bed, okay? So I couldn't move. Even I wanted, even if I wanted, I couldn't move. And before that, 1 hour before, I inserted a medicine that would help to expand a little bit the area so I wouldn't feel pain, just uncomfortability. I couldn't hold the meds for a long time. It was very painful already, so the doctor decided to take 15 minutes before the procedure. So I was laid down there. There was nurse around me. One nurse gave me her hand, so I was holding. When the probe came inside, I felt a click. The click alerted me. The probe was going inside, so I was okay, I can hold. But suddenly, there's no way to hold the pain, and I was screaming. Jun came, he opened the door. The nurses were fighting. I couldn't close my legs, I couldn't move because my hips was attached to the bed. And then when they were cleaning my womb, I passed out. I could feel the sound going inside the tubes, inside something, because the pain was following this. And after the procedures, they cleaned my womb, and that product burned as hell. It was that time when I passed out. While the sonda was going inside, I was screaming, and when they are cleaning, I passed out. The doctor was actually, she told Jun she was shocked about my reaction because it was the first time in her 20 years working with this procedure, all this treatment. In fact, nothing happened. She didn't hurt me actually because there is no blood, everything was perfect. Why no anesthesia? They said some woman after this procedure got pregnant. It's a kind of common sense to not put any substance in the woman's body once they know they are going to have a chance to have a natural conception. They think if they put some anesthetic substance inside, they will disturb the possibility to get a natural pregnancy. So they decided to not give me an anesthetic, and I didn't know it was also a possibility because in Brazil there are some clinics that they give the anesthetic. I remember to have asked her to stop many times. Thank God she didn't stop, because otherwise I wouldn't be able to try now the natural pregnancy. And plus, here in Korea, they have less tolerance about drugs. It means they only give you anesthetic when it's really needed. As my husband said, it's like life or death. They think if they give some anesthetic when the procedure is not required, that the painful is tolerated. It's kind of abusive of drugs. He also told me there's some hospital they give anesthetic for other procedures that others doesn't give. So it's depends. I don't know exactly. So now I want to also explain you why they didn't know I would have this low tolerance for pain. My husband took one tooth, he had anesthetic, but after that, different from Brazil, where you can have, if I'm not wrong, 3 days to recover at home. Here in Korea, they go directly to work. He took the tooth and he went to work. My husband's friends, also he had an accident working in the port. He fell and he broke his arm. He went to the hospital, he received the treatment, and instead of go to home or stay at the hospital, he went back to work. Another friend also, he cut his hand. He asked to go to the hospital because it was a dip, but the company where his friend was working, because he's not working there anymore, saw that. He said, no, it's not that deep, you can work, just put a band-aid and go back to work. But no, he was shocked because it was deep for him, because he's a foreigner. Because of that, you can imagine what is the level of tolerance of pain for Koreans, especially men. So the tolerance for pain is high. And I don't know if it is because cultural difference. We in Brazil, we are kind of pampered. My father is an anesthetist, so you can imagine, even a small cut, my dad always had some ointment, something that helped me. I was researching about tolerance of pain, and I discovered one thing very interesting. They were analyzing a little girl, 3 years old. She had a band-aid on her hand, and that little girl was ripping off the band-aid. She was screaming as she was dying. They were laughing about that pain because, come on, to rip off a band-aid would pain like that? What the therapist said is, for that little girl, 3 years old, that was the maximum pain she have ever felt. So it makes sense. She doesn't know that other highest pain, things more painful. So maybe I think it was what happens to me. When I was laying down there, I didn't imagine that the pain would exist. That was the highest pain I felt. But maybe here in Korea, I don't know what kind of pain Korean people had when they were growing up. What the doctor said, what I would feel would be something uncomfortable inside my womb. Only that. What is uncomfortable? It's something like pressure, like cramp, right? Not like something cutting me and burning me like this. Maybe, I don't know, I was the only one who screamed like I was dying. Maybe I was that 3 years old girl ripping off the band-aid. Maybe the pain I felt wasn't that much, but in my reality it was too much. The comments I receive here make sense. Maybe they don't know the level of tolerance in other countries. So maybe girls in the other parts of the world, they has less or more tolerance than Koreans. So maybe in the future, I don't know, they would try to understand this more. I don't know. It's not the fault of the hospital or the doctors, because they just follow what they have experienced so far. And so far, Korean women have never screamed and complained about the pain. It was just uncomfortable. But for me, it was another level of pain. Everything, unimaginable pain. I told you, I faint. The reason she didn't give me it was, first, she didn't know I was react the way I was react. She didn't know I wasn't that tolerant for pain. And third, she thought it would be better for me to have a higher chance to get natural pregnancy. I also read here another girl did the same exam and she almost fainted. Maybe for us Brazilians it is higher pain than normal. Other comments said, this is not a humanized service. What I think it is because they don't understand people can have less tolerance of pain. Yeah, why they don't humanize? Maybe because they don't need this. We as Brazilian, we are so used to be, I don't know if pamper is the correct way, but we are assisted too much, and this is good, really good. My family also told me to have the baby in Brazil because they believe I will have the assistance and all help I need. And they really believe after this procedure I will be kind of alone in the hospital taking care of everything. But so far, everything is okay. Thank you for watching this video. I hope I could clarify a little bit what happened. It's not the hospital or the doctor's fault. I think it's just culture stuff. Is this how this society works? Guys, I hope next week I will have great news for us. So cross fingers and see you next video. Bye bye.